Thank you so much for joining us today for this amazing episode. This is going to be about a super hot topic in direct primary care, and that is the virtual assistant in the DPC space. So I am so excited, not only because I have experience with VAs, but I've also gone through the process of having a VA, not having that VA, hiring a new VA. And so the things that we are going to be talking about really matter to the DPC doctor who's opening from scratch and who is hiring a person for the first time, especially. So, when it comes to healthcare and medical virtual assistants in particular, there are so many companies out there. However, how do you know which one to choose from? How do you know which one will help you find the VA who's right for your practice? I am so excited to introduce you to Justin Lam of Cool Blue VA and his sister, Dr. Carrie Lam, who has been thriving because of the Cool Blue VA virtual assistants in her practice. They will be talking all about Cool Blue VA and introducing you to the many aspects of using a virtual assistant in your practice. Thank you guys so much for joining us today.
It's great to be here.
So, I had the awesome pleasure of meeting both of them at the California Academy of Family Practice meeting last summer. And what I really love is that not only are you guys really involved in the quality of virtual assistants that you're bringing to the workforce, but also personalizing the virtual assistant experience with the doctor and the clinic that they are running. So, Justin, can you start us off with how did Cool Blue VA even get started? And how are you continuing to build this amazing path forward to personalize the VA and physician experience together?
Yeah, absolutely, doctor. Once again, thank you for having us on here. Really excited about this. So, Kubu VA really started from our own clinic, actually. So, Dr. Carrie, my sister, and my brother, Dr. Jeremy Lamb, actually opened up a clinic, I think it was about 4 years ago now, right when the pandemic actually started. And at that time, Dr. Carrie was also a new mom. So she had a baby girl right around the same time as well. And opening up a new clinic, a new business, and being a new mom, there's a lot to juggle as far as that goes, right? So she was really having a little bit of a difficult time. She was staying late at work. She was taking her notes at home to chart, and she was struggling to balance the work and her life at home, being a new mom, taking care of her daughter. And so it was kind of burning her out. And she was kind of struggling a little bit. And it was breaking my heart as her brother to see that going on. So we know we needed to find a solution to help her out. And it's a good thing we found these virtual assistants. They're based in the Philippines, and they're highly qualified medical professionals that are able to just help you with anything in your practice that you need, short of touching a patient, really. So with that, which will basically bring down her workload, assign a lot of things out, and so she's able to go home now at 5 p.m., spend time with her kids, have a healthy balance, live a great life, and have a profitable clinic as well. So that's where everything kind of stemmed from there. And so it helped her out so much that we decided to open up Cool Blue VA really to help other doctors out as well, because there's such a need to get doctors really the help that they need to increase their efficiencies so that they can run a successful clinic as well and have a healthy balance in work and life.
Absolutely. And I know that that speaks so much to the listeners who are exploring and pursuing DPC because they want to make sure that they're not just living their life in a job that does not allow them the time to also be the person that they need to be in order to go to work the next day. So this definitely speaks to people, whether it's bringing a new person into the family, like Dr. Carrie, or whether it's somebody who's been asked to check off one more box on the EMR chart from their employed fee-for-service job. So after you guys realize, hey, this is a space that we really understand and that we're really passionate about, how did you guys bring on these VAs to make sure that they are up to par with what you guys are wanting to deliver?
Yeah, absolutely. So as I mentioned, we have our own clinic ourselves, so we really know what is required of these virtual assistants. We've gone through our fair share of them to refine our process and make sure that they're really good for our clients. And so what we've come up with is really, as far as the interview process is concerned, we have 3 rounds interview and testing that we have the virtual assistants go through to make sure that they have the knowledge, that they're well spoken, that they have the skill sets, the educational background, and everything that they need the motivation and whatnot to make sure that they're going to be successful in somebody's practice as much as they would be successful in our own practice is really how we're thinking about it, right? After that, then we also put them through a training program. The training program is very strict and very regimented. We do want to make sure that they're performing well, that they don't just interview well and then drop off a cliff, right? So we want to make sure that they're performing well over an extended period of time, and then they're picking up skills that's really going to help you out in your practice. And our training program only has a 40% pass rate there. So we're very strict about who we let go. And only after they pass our training program do we feel comfortable signing them out to doctors and other clinics to really work for them as far as that goes there. Once they are assigned out to a clinic, we also make sure we keep a very close eye on them. And we also like to work very closely with the clinic as well to make sure that they're having the most success possible when they're bringing on the virtual assistant, whether they've had experience with other previous virtual assistants or whether this is going to be their first time bringing on a virtual assistant. We like to work very closely with the clinics because there's always something different when you're bringing somebody on that's halfway across the world and whatnot. There's always going to be a little bit something that's different. So we like to make sure we work closely with our doctors, our office managers, or whoever it is on that.
Amazing. Once a VA is paired with a client and you're supporting both sides, the physician and the practice, as well as the VA, how do you facilitate the integration of the two and making sure that the VA is working with the needs of the clinic and the clinic is also working with the needs of the VA?
Yeah, so right now, what we found to be really effective, and what I don't think many other virtual assistant companies actually do, is that we offer a 2-week free trial so that you can actually work with the virtual assistant for 2 weeks, 40 hours a week, really get your hands dirty, get involved with them. And we're checking in also at the same time we check in with the clients every day during that 2-week process. And we check in with the virtual assistant every day during that 2-week process. If there's any hiccups or any speed bumps, we'll get together and we'll try and iron it out for you guys. We'll provide solutions because we've gone through this with many other clinics, with many other virtual assistants, right? So we're eager to pass that knowledge on to you guys to make sure that you guys have success. If you guys are trying to implement something new with your existing virtual assistants, we're still happy to help that out. Really, we just want all our clinics to succeed and do their best. So we try and stay pretty active with them and provide solutions to onboarding or solutions to any new projects or tasks that they may be bringing on. We're very happy to discuss. And if we don't have the answer, we'll let you know, but we're going to try and find an answer. We'll go talk to another client, say, hey, maybe, they're trying to do this. Do you have any ideas about that or something? And we'll try and do some research for you at least.
And again, speaking from experience, I think that that is such a valuable thing that you guys are offering because I remember when I was hiring my first virtual assistant, did I have the perfect job description? No. Did I have the frustration of, oh, shucks, like I need this done? Oh, it was never explained to or expected of the VA from the beginning. And so I think that this is really, really helpful in terms of people who are wanting to deliver that high quality of care to also have assistance for those people who might not have hired before, whether that be a virtual assistant or in-office person, to have help with how to hire somebody. And so that is definitely something that you're right in terms of having this ability to have basically a working interview is really, really unique as well. Now, in terms of the people who are within only this 40% pass rate, can you share with us who are the people in terms of their degrees that they're bringing to the table as medical virtual assistants through Coolblue VA?
Yeah, so we actually are very specialized in who we get, and it really depends on what you are looking for. If you're looking for more medical assistance, then we'll find nurses, physical therapists, pharmacists, lab techs. They all have medical professional degrees, and they'll all have clinical or hospital experience working in the Philippines. So they really have a wealth of medical knowledge that's really going to benefit you and give you a lot of medical assistance. If you need more help with insurance or let's say customer service, then we'll find people who have backgrounds in that area. So for customer service, we'll find people who have worked and taken calls from Americans. That's what they've been doing for 3, 4 years. So they sound really good on the phone. They sound really professional. They're super empathetic, and they're really going to try and put their best foot forward to really help the patient out and help your practice out.
Wonderful. And so needed these days when no matter where you are, rural or urban, it's really hard to find quality workers today. And to really find somebody who is able to carry the culture of your clinic and be your representative when you're in the room with a patient or whatnot is awesome. So let me ask you here, if a doctor's out there and they're wanting to hire a virtual assistant through Coolblue VA, can you share with us the pricing and how the hiring works?
Yeah, absolutely. The pricing is very straightforward. It's just $9.95 an hour. And there is a 32-hour minimum in a work week for that rate. If you want to go part-time, we can provide part-time as well. And that rate is a little bit higher. It's $12 an hour. So between 20 hours and 31 hours, then it's $12 an hour. Once you hit 32 hours and up, it's $9.95 an hour. And we bill every week. So the virtual assistant will submit their hours to you every Friday for their shift that they work that week. And then we would just charge your credit card on file come Monday. And if you want to get started with the 2-week free trial, all you have to go to is coolblueva.com. That's COOLBLUE, V as in Victor, A as in Alpha.com /2 weeks. And then you can fill out that form, and then we'll have a conversation. I'll get to know what your needs are. And then once I know what that is, then I can find the perfect virtual assistant and then get started on that 2-week free trial.
Wonderful. And it addresses a big anxiety I find in people who are starting DPC is the financial commitment. And so I think it's very flexible that you guys have a week-to-week commitment, that you guys have options if a person wants to hire below the 32 hours a week. And also in terms of having a medical virtual assistant for $9.95 at 32 hours a week. I mean, that is a lot of work for an affordable rate. And so I think it's really, really important for people to know that there is a way to bring a VA that is also flexible, that you're not locked into a year-long contract or whatnot. And what happens if after a 2-week period, a doctor's like, I think you're good, but I think we're looking for a different VA for our position. How do you guys address that?
Yeah, absolutely. The beauty of it is that it is week to week. So if at any point in time you're not satisfied, you come to me and say, hey, Justin, I don't think my virtual assistant is really grasping what I'm trying to teach them to do, or they're just not gelling or something like that. Not to worry. Just let us know what the problem is. We'll either talk to the virtual assistant, try and come up with a solution, or if we can't come to a solution, then we'll find a virtual assistant that's going to be a better fit for what you're looking for, so you can really maximize the efficiency in your practice.
And then what about, because life happens, I mean, we had this pandemic that nobody expected and so we got through it. But in terms of when things happen, maternity leave, paternity leave are really common things that happen in life period. What do you guys do if the virtual assistant who is already paired and perfectly fitting with a clinic needs to have time off for leave of any sort?
Yeah, so yeah, we understand life happens, things are going to come around, people get pregnant. And so we obviously want to make sure that, well, number one, the virtual assistant is taken care of, they feel secure in their position, but also, very importantly, that our clients, the doctors, the clinic also does not have any gap and is not struggling to fill that position or anything. So typically what we'll do is we will actually have a substitute virtual assistant start training with your current virtual assistant, usually about 2 to 3 weeks before they're scheduled to go on leave. And they'll be trained up and they'll know all the tasks and have the knowledge that your current virtual assistant does. And so once the current virtual assistant is ready to go on leave for any reason, the new substitute VA can slot in very easily and take over the tasks and transition very smoothly. And things will be pretty much, any problems will be kept to a minimum.
And now another question in regards to virtual assistant needs. If somebody is wanting somebody who is medically trained but also does social media marketing, et cetera, and they're leaning more towards we need to grow the clinic rather than have somebody really focus in on clinical needs, do you have ways to address those needs from clinicians as well?
Yeah, absolutely. Absolutely. We can. We can find virtual assistants to fit any needs, really. So if they need help with social media, posting on Instagram, posting on Facebook, we can find people that are really experts in that area. We also train in our program, we also train them on how to use ChatGPT now. So they are AI savvy, so they can create content for you, can create descriptions for you, copy for you. So they can really help you out. If there's anything that they're not sure about, they'll be open to tell you about it. But because most of the virtual assistants they have a medical degree, they're actually very intelligent people, right? So they are usually can pick up on stuff and new tasks very quickly. But even if it's something very specific, like if you wanted a bookkeeper or something, we can find those virtual assistants for you as well.
Wonderful. Thank you so much, Justin, for that really amazing introduction to the services that you guys are bringing at Cold Blue VA. Now, Dr. Carey, I want to turn the mic over to you because we know, especially those of us in DPC or who are exploring DPC, we know the difference between physician autonomy over your own life, your own practice, and what it is like to not have that. So, can you start us off with what was your life like before you were able to have the virtual assistants through Cool Blue VA?
Yes, definitely. In the beginning, when I first opened my practice, it was a lot of tele that I started with because it was just at the beginning of the pandemic. And so I'm sure a lot of doctors can also kind of relate in their, oh, when I'm doing a tele visit, I have to connect to the patient and then I have to tell them everything. I have to do all the vitaling, let's say, online, get their allergies, their medical history. I have to get their payments and I have to write the note at the end of the day and counsel them on everything that and I have to go through all these technical difficulties. Just getting a lot of it was just like, why am I spending my time doing this as a doctor? I really just want to be able to help as many patients as I can. But a lot of your time is spent on the clicking in the EMR. Right. So I'm sure we all have that headache. And so before having a VA to help me, yes, it was all me. And I had to do all this, stay up to midnight and burn the midnight oil, still be with my baby. It was definitely burning me out. And so I think it was just very helpful to be able to know that there was help with virtual assistants. Because even when I opened my actual practice, it was just such a high turnover rate for medical assistants. It's very hard to find people that will stay and you can grow with. And so with the VAs being there longer term was just very helpful because just long-term employees, they know the system, they grow with you, right? And so first I got some scribes in, but my scribes I trained to be able to not only do notes, but screen the calls that come in, do all my messaging and even the inboxing. Of course, it's like a graded approach, right? They're not going to do everything all at once. Once you kind of get them trained on your system, first probably will be doing the notes. So when they can even connect on a tele call ahead of time. And so they do all the connecting. They call the patients to connect them. And if they don't answer, they message them, right? So I actually have two scribes per provider usually. So when one person is doing the notes, the other person is getting the next patient ready for a tele visit. And so when they're getting the patient ready, they actually collect copay. They also make sure that all their medications are updated, all their supplements are updated. They get their chief complaint. I even sometimes train them to actually get HPI portion to get started if the patient's waiting for me. And then during my visit, they go through and are now able to put in all my favorited assessments and then the treatment plan also. And the treatment plan sometimes is pretty complicated in what I do because I do a lot of supplementation and natural and nutritional counseling. But they can write all those notes, they can order labs for me, and they can actually put in the medications. I still sign off and make sure I send it myself, making sure that everything looks good. But they do all that prep work. And then after the visit, they they stay on the line. They actually counsel the patient even more. Okay, I'm uploading this to your portal, so you want to go in and find that. And then any additional charges that they may have, they are able to do that. So it's just a huge help, like having a scribe to be able to do that. And those are tele appointments. And then for even my in-person appointments, they're doing the same exact thing. I do have medical assistants in clinic to be able to do the charging and the rescheduling, but on the back end, the scribes will be able to do a lot of it. So it's definitely made my life much better being able to go home and do less of the admin that comes with a lot of note taking and medicine nowadays.
Totally. And I know that there are listeners out there who are like, oh, I need that. I need that. And one of the things also that I love that you really focused on is a VA that will grow with you, right?
Mhm.
And so can you share with the audience what is your practice like? Because it's very different than when you opened in 2020.
Yes, yes. Well, now, yeah, we're at Lamb Clinic. We're in Orange County. We have two MDs, so it's actually me and my other brother, Dr. Jeremy Lamb. We opened a family medicine, integrative medicine practice, and we have actually hired now 3 NPs and 2 PAs. So we're definitely growing in the past 4 years to be able to help service the people here naturally and also conventionally. And so with that amount of growth in providers comes the growth in the VAs also. So yeah, we now have over 30 VAs, all right, with different departments. So like I said, 2 per provider. So we have around 8 to 10 scribes. We have 6 for customer service, just answering phone calls. And then we have another 6 for insurance team, and then 6 for back office. So it really adds up because there's just so much that we can utilize them for, and they're so helpful. For our customer service, right? Like they've just been a game changer. Everyone has had that experience of calling the doctor and just keeps ringing and ringing and ringing and no one answers, right? And so I kind of didn't want that for our practice. So right now our answer rate isn't like 95% answer rate. So the RVAs are trained to answer in 3 rings. That's their goal. They have to answer it. And so uh, we also train them to take the marketing calls more seriously. And so we have like specific marketing calls that come in. They know how to close them, how to actually sell them. So we have a 90% close rate also for our marketing calls. And so they've really helped reduce a lot of the call load on me because I train them also to answer the calls in a correct way, right? A lot of times you can have they can answer the phone call, but you're like, that's not enough information. I need a little more, you know? So when you work with these VAs, you train them, say, hey, if they're asking for a med refill, make sure you get the pharmacy, make sure you get the dosing, the dispense, when was the last appointment, when's their next follow-up appointment. Those are just things that just takes training, but they can definitely do. And so then that will actually cut down so much back and forth with the patient, right? And then also on the doctor time. And so even with our VAs, we have different tiers, right? So we have the tier that answers the phone calls, and then we have another tier above that of someone who's more well-trained that can actually answer problem calls first. And then it comes to me. So it's different levels of training so that they would be able to, by the time it comes to me, I used to get like 20 problem calls, 100 actual phone calls a day, but 20 problem calls that I had to answer. But now with this tiered system, I maybe get 2 to 3 per half day. So it's much more handleable of a system, I would say, for our customer service calls.
And I'm sitting here thinking the amount of time that I spend on a phone call always is more than the amount of time that I would spend in a virtual message or with just streamlined workflows like you're talking about in terms of like this tiered system to be able to get the answer to the patients when it's not an acute thing that I have to address with my medical training. So I really think that's important for people to hear. Now, when it comes to the tiers of how you are structuring the call system, do you also structure your VA experience at your clinic such that that there are the VAs who have been there longer helping the younger VAs basically get onboarded with the culture and workflow in addition to Cool Blue VAs optimizing of that integration?
Yes, we've done this for so long. It's definitely now older VAs, the more experienced ones, are training the newer VAs that come in. So really, a lot of it is off my plate. Yes, I did have to go through in the beginning to create the training schedule, the training checklist, the videos, the operating procedures, you can say, right? All of that. But you do that as a one-time thing and you keep updating it so that you can move forward with any new person that you train. I would say though that Kublu VA already does a pretty good like training. So by the time they can come to me, it doesn't take so much more compared to when I had to hire my own VAs and try to train them from the bottom up.
Yeah, it's actually interesting that you bring that up as well, doctor, because actually thinking about it now, our virtual assistants are actually our most senior staff. They've been around longer than actually our physical staff have been around now. So they know the clinic inside and out, and they really train the virtual assistants up. And now that the standard operating procedures are up and running, they actually update the SOPs whenever we institute any changes or whenever Dr. Carey institutes any changes as well.
And anyone who has developed an SOP knows how useful they are to your future self. So I think that that's so great that, especially as you guys are talking about teams to grow with, to have somebody who is already knowledgeable of like where to find the SOP, what needs to be done to optimize it, or having that discussion, and that they can help document that. And it's so, so helpful. And this is speaking from someone who was like, go and then figure out the SOPs. And so it's very helpful to have that organization for your future self, 100%. Another hot topic that is mentioned very frequently is, how do I know that they're like on the clock working for my clinic and not just like running down the clock in general? How do you guys address that concern with clients who come to Cool Blue VA?
Yeah, we definitely want to make sure that they are working when you are paying for them to work, right? So every morning when they clock in, we all have a Teams chat, right? So everyone on Teams says good morning, so you know that that's when they clock in, and they all have to join a Zoom breakout room based on their department. And so their whole time that they are in the Zoom and they have someone monitoring them, meaning like one of their team leads. And so if there's training, we like the Zoom room too, because you can always share your screen. You can show them how to do things. You can record and then put that into procedure. So we like those virtual Zoom rooms a lot. In addition, the Kubu VA uses something called Time Doctor. So it actually keeps track of going in and going out, when they're taking their breaks, when they're going on lunch, and also takes screenshots of their screen. And tracks their idle time. And so if they're not moving their mouse or your keyboard, then you kind of know that maybe they're not working. And so we actually have an auditing system too, where someone goes into Time Doctor and tells us if any of our VAs are idle and not working. Then we are able to really keep track, because it is hard. Like me, I'm seeing patients all day. I'm not going to be keeping track of my VA. And so I like that software to be able to keep track of them.
I'm sure that that really addresses some people's fears about like, it doesn't have to be virtual, but there are definitely people that we've all worked with where it's like, you're here, but you're not helping run the clinic. So I love that is how you guys address it. And also, I mean, you guys have a 40% pass rate. So you guys are really weaning out who is going to be an excellent pair for future clinics and clients. So when it comes to Dr. Carey, especially like you having been through this, you developing the SOPs, the workflows and whatnot, the videos, like you're saying, do you have any tips for people who are not yet with the VA, but they are thinking about, how can I work to document my own processes so that I can bring a VA on easier if they don't have a senior lead VA or a clinic manager in existence with them at their practice right now?
Right. So having your own procedures written will probably be very helpful. But if you don't have procedures written, I think the first step would be to see the tasks that you have that you think would be able to pass on to a virtual assistant, which is basically a medical virtual assistant can do anything a medical assistant can do, short of touching the patient, right? So first, I would probably list out all those tasks that you would want that VA to do. Then, when you are training the VA on that specific task, I would record your training and put it into a folder. We use Google Drive for all these videos so that they can always refer back to that Google Drive link. So I just basically, if you don't have any like fancy task tools or anything, you can create a spreadsheet, Google Drive spreadsheet, and you put all your tasks on there. And then the second column would have the links of your trainings. If you wanted to make a third column when you're a little more into this, is that a VA can actually go into that video and type up the procedure themselves of what it would look like in a Google document. So then as you start developing these procedures, you can go into the written part and actually edit it if there is a change. So you do this once so that the VAs can have it for a lifetime, right? Or any additional person that you train can have it for a long time. So it will ultimately, it might be a lot of time in the beginning, but it will really save you a lot of time later on because from my experience, you get one VA, you're going to want to get another one. You want to get another one. So it's so helpful that you don't want to spend time doing all this training. So if you can do that with the first one, it will probably be very beneficial for you. So that kind of system, right? And then we create different tabs for different people and that this training checklist will get duplicated for the next person. Okay, then you have them sign off. Another column will say, okay, date trained. And then another column will say tested and then passed. So for all our VAs, we not only train them, we make sure that they can do it themselves, and then we pass them if we test them, basically. And so this is a more systematic way of training VAs, but also medical assistants in office, right? Most of the things that you do needs to have these lists so that you can stay organized and stay ahead of training schedules.
Absolutely. And I think that that's a really, really key tip there. I love that how you mentioned, even if you have a video, but you don't have it typed out, that's a way to actively engage with the video for the virtual assistant to be able to write down the SOP from that video. So that's a really great tip. Now, I just want to go back to the customer service portion, the people answering the phone and how you do the tiered phone system. When it comes to clinics, direct primary care clinics very often are single physician practices from day one, and then they can grow from there. But in terms of people who still want a phone tree or a way of segmenting the calls if they don't have a phone tree system, how do you guys assist the practices and the virtual assistants to get something like that up and running for the practice and the doctor?
From Coolblue VA side, they already do mock calls before they come to us. So because they are in this testing environment and they actually test them ahead of time. Okay, are you actually able to answer phone calls from real patients or from test patients? So they test them on their customer service, closing, and also marketing, and also just any type of refills, labs, referrals, inbox messaging, things like that, faxes, documents, any question you can think of, right? You want to be able to write these down and give them to the VAs to prepare them for what kind of calls can come in. Definitely from Kublu VA, they are training them more on the empathetic side, right? On how to listen well, how to actually be very nice and sunny and on the phone sound very great and friendly. And so that is also very important for our customer service calls, right? You want the patients to feel like they're part of the family. Our VAs are also part of our family, so they are happy working. So you want happy VAs so that they will also be able to transfer that to the patients when they answer phone calls.
And just to touch a little bit more on the technical side of things, doctors are not always going to be the most technical savvy or anything like that. So we have our own in-house technical team as well in Kublu VA. And we'll be happy to either jump on with you, try and figure some stuff out, maybe show you how to do things a little bit more efficiently. Or if you have a technical team already in place, we'll be happy to communicate with them to make sure that you guys have the right tools and the right setup for your virtual assistant to succeed.
I think this is so great for people to hear because when I think about the DPC early on in practice, definitely people are very wanting. They're very willing to practice the elevator pitch to their community, to their patients who are going to be future members. But as the practice grows and you have 50 patients, 100 patients, and you can't necessarily take the time to do the elevator pitch any longer, and you still want a person to be able to communicate that elevator pitch to your potential members versus a voicemail. And again, that's definitely a physician preference. But if that's your preference, this is definitely a way to bridge that ability to have that person there, but also the ability to be focusing on your patients. And like you said, Dr. Carrie, focusing on the medical, what you went to medical school to do aspect of your practice. So with that, a question for both of you in terms of, and again, I love this 2-week working interview with the VA, but in regards to what happens after that 2 weeks, how do you guys continue to support the VA and the practice beyond those 2 weeks to make sure that this is continuously a good fit for both the VA and the practice?
Yeah, so in regards to making sure that it's going to be an ongoing, successful relationship, we check in with the VAs on a weekly basis to make sure that they're doing well, everything at their home is doing good, they're happy at work, they're not having any problems. And we also like to check in with our clients as well. So we touch base with you guys on a weekly basis. Some of our clients say we touch base with you guys too often. They want us to stop bothering them as much. But we like to make sure that everybody is happy, everybody is getting their tasks done, and the jobs are getting completed. So we do make sure about that. And also, we continuously offer training as well. So if there's any changes that we feel are, in the practice that come up, things are happening differently, we offer continuous training for our virtual assistants. It'll be after hours, so it's not going to affect your working hours or anything like that. And then we also make sure we have annual continuing certification for HIPAA for our virtual assistants as well. So you continue to feel safe and secure in utilizing them.
And in our clinic, just like any other employee, we tend to do our reviews every 1 month, every 3 months, every 6 months, and 12 months. We want to keep track of them, make sure that they're filling out their self-evaluation form and they're making new goals for them. They're just really, they want to learn. They are very hard workers. They're very appreciative. They will do anything you ask them to. And so we want to kind of continue to push them to grow and to learn and to also educate them so that they can be part of our work family. And so I think that the constant evaluations will keep us on track.
I just really love your guys' overall approach because even Dr. Carrie, as you're talking about that they're part of your work family, we definitely feel that, with our virtual assistant. I love when you are like, you say a name and like there could be 4 people with that name in your practice, but they know exactly who you're talking about. And I also love the idea that you're focusing on meaningful work for them also with the goals and having them do self-evaluations. I think that that really speaks to culture of a practice too, right? So when we have people who are talking about like, how do I build culture? I just had a conversation with a DPC doctor in Texas about this, but it, everybody being involved, I think is also something that we really craved in fee-for-service before choosing DPC because for us, it was like, it's very common to hear, we tried to make a difference. We tried to change something. We tried to make something more efficient, but we weren't heard. And so I think that that is really awesome that you guys are focusing on not only having a virtual assistant support the physician so that they can do what they need to do, but also so that the virtual assistant can also be growing with the practice as well professionally. So let me ask you there, when it comes to just again focusing on that culture of the practice, Dr. Carrie, especially, how do you promote the culture in your practice so that you make sure that your VAs are feeling valued and that they are showing that value and happiness through their interactions with your patients?
Yeah, you do check-in every day, right? You see them in the Zoom room, you make sure that they're doing well, they know what they're supposed to be doing. A lot of it is also incorporating them with your medical assistants, making sure everyone is on the same page. Communication is huge, right? There's so much miscommunication that can happen, but that's why you do the double check, you do the triple check, you have everybody on teams. I think being very open and having better follow-up is very important for dealing with your VAs. And so I like to just also say that we challenge our VAs, right? I think Coach Justin said they are smart because they are healthcare workers. And so I've even trained my scribes, okay, well, you need to come up to me with your recommendation. Don't just say, I have a problem. What do I do? I want you to be able to say, okay, this is what I think I want to say. And so that kind of challenges them too to improve themselves and to be able to communicate better, right? Here in America, we talk about SBAR, right? The form of communication. We train that in our VAs also to be able to do that, to teach back, to communicate back to us what we want. And so even when I'm doing my scribing with my scribes, they have to I get feedback right away because on the Teams chat they are saying exactly what I said. And so I think that kind of communication has to be very open and very clear, creating tasks lists for every person individually so that they know what they are supposed to do and by when with due dates. Those are also very important, right? For the VAs, it is very good to be organized to say, okay, these are all your daily tasks that you have to do. And then if you have something that you're adding on, then you put a due date on that also. And you train them to also be able to come back if they have questions and train them to also be able to come back if they're not able to finish things on time. That's where the culture of responsibility as an employee also we want if their attendance is not very good, we talk to them, hey, what's going on here? We want to make sure that you keep your work very serious. This is a professional environment. So to have these long-term relationships with our VAs, we're very, very open. They're really just like any other employee. You care for them and they will care back for you. So they definitely they give their all and I'm very grateful.
Amazing. So for the listeners who are wanting to go to the next step and wanting to partner with Cool Blue VA to bring a virtual assistant to their practice, how do people go to the next step and get in touch with Cool Blue VA?
Yeah, so once again, our website is coolblueva.com. That's COOLBLUEVA, Victor Alpha.com. And you can do /2, the number 2 weeks, WEEKS, and that'll let you sign up for our 2-week free trial here. And we'll also are going to be exhibiting at the DPC Summit in Dallas, and that's going to be from June 20 to 23rd. So if you guys are curious, you guys want to learn more, definitely come find our booths there. We'd be happy to talk to you more, learn about what your clinic needs, and help provide you with solutions.
Dr. Carrie, do you have any additional words you'd like to share with the audience?
Yeah. So as a doctor, I can relate to a lot of you guys. We didn't come out to do business. We didn't come out to manage people. We went to med school to be able to help patients, but that knowledge a lot of times is not there, right? To come out and be able to handle all this admin. But I can say that Kubu VA has really, really helped me. And it stands out because really they help the clinic set up. They help their VAs. Everybody is set up for success in that they want you to succeed. They want the VA to succeed. They are able to provide so much of these tools that you don't know about or that you don't yet know about to be able to not only help your current practice expand, but also to be able to do what you love as being a DPC doctor, right? To be able to focus on yourself and your patients so that all these other things can be handled in the background. So no more burning midnight oil. Definitely get that 2-week free trial. You will not regret it. Like I said, I went from just me and one VA now to 30. And so it is kind of like an addiction. You just keep hiring more, because they really can just help so much from even ordering my food for lunch to helping me with social media now and creating my content and newsletter pages and website and IT and scribing and back office, uploading, anything that you really can think of. They're there to really just help you be a better doctor. And so, Yeah, get your free 2-week trial with your personal VA.
Thank you both so much for sharing about Cool Blue VA. And again, coolblueva.com/2 weeks. And that will get you your 2 free weeks, 80 hours of a virtual assistant in a live interview, basically, for your practice to ensure your practice has a great fit of a VA and someone who will grow with you. So again, thank you guys so much.
Thank you.
And thank you, Marielle.
Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Marielle Concepcion.